Okay, listening ones. All right. Hello, this is Iyo Meska, and I'm so sorry in advance. My voice is kind of deep. Was sick for the past 3, 4 days. So this is the clearest I could get. I'm so sorry about that. But I can't do anything. I was sick. Um, in today's topic, we're about to discuss the future direction in healthcare informatics. And my name is Iyo Meska. An introduction, we will be discussing the importance of precision medicine and AI in healthcare. The fact that AI is overtaking the healthcare system. It is about that time to bring it and talk about it, how will we implement what is going to be the future of the healthcare system. So before that, I would like to say welcome everyone. Today we will be discussing our plan to implement precision medicine and artificial intelligence, AI, in our clinic. This advancement will help us provide more personalized and effective care to our patients. So, precision versus personalized medication, medicine. Sorry. So when it comes to precision medicine is an innovative approach that tailored medical treatment to individual characteristics of each patient, which include their genetic makeup, environment, and lifestyles. For example, using genetic information to determine the most effective drug for a patient. Whereas the personalized medicine is defined as personal medicine refers to the customization of healthcare. The words is personalized, which is customized of healthcare with a medical decision, practice, and products being tailored to individual patients. Example, like adjusting treatment plan based on the patient's personal medical history and preference. So, like I said, with with this to include the genetic lifestyle environment. And when it comes to personalized patient-based broader medication and personal information would play a significant role in determining which one is best. So the other thing that we are going to discuss is the data collection protocols. There are 3 procedures that we have to follow, which are medical history of the patient, genetic informations, and diagnostic reports in order to collect the data. Perhaps this is the most important topic that everyone needs to be discussing in terms of data security and privacy, according to the HIPAA overview of the Health Insurance Portability and Accountability Act. Every patients have the right, and everyone need to be safe, whether we are releasing their data or any information in regards of their personal life or education or anything related to healthcare. So ensuring the patient data confidentiality, integrating and availability will comply with the HIPAA. And also regular audits and risk assessment is also a key factor when it comes to security. Excuse me. Secure data handling procedures us to follow inscription of data in transit and rest, secure access control and applications measure, regular training for staff on data security practices. In fact, I would highlight this part, regular training for the staff of data security practices is very, very important. The fact that we are dealing with sensitive information, we have to be more cautious we handle the data and what we do with the data we have. So this part play a significant one. Implementation of secure data storage solution is so one way of handling procedures of data security. Patient selection for pilot implementation. What are the criteria for the patient selection? When it comes to the criteria, patient with complex medical history requiring tailored treatments or at the first individuals genetic condition that could be benefit from personalized patients, pediatric and elderly patient with multiple multiple comorbidities, also willingness to participate in the pilot and feedback also has key into it. The expected benefit for selected patients are tailored plans based on comprehensive data analysis, because first we collect the data, so we will have a clear definition of what we're going to do in terms of care plan, and also improve health outcome and quality of life, reduce risk of adverse reactions, like that, where we have an idea what we're going to do and how we improve their health would have a big impact to it. Finally, empowerment through active involvement in their care. So basically encouraging them to be active or to do different type of exercise, how to change their lifestyles, stuff like that, has also played a significant role. When it comes to treatment plan development, we use AI algorithms. AI is really, it becomes like a backbone of the healthcare system at the moment, because it does everything for the patients and also for the staff. But since it's like electronics or it's like a robot, we have to be cautious how we handle it or how we use it. However, when it comes to on the positive side of it, AI-driven predictive analytics for early disease detection, because we use algorithm, we gather data in the AI or artificial intelligence will tell us, okay, this is happening, what this, that, and how we manage it or how we detect the disease at the early stage have a big benefit. And also machine learning models to identify optimal treatment pathways, integration of clinical data with AI for personalized medication, continuous learning from patient outcomes to refine algorithms. Also, one of the benefits of using the AI algorithms, and it really regenerate every time when we have data that can be run to analyze it. So the algorithm calculate everything for us, what is going on, what should be done, stuff like that would have a big help to the healthcare system and also the staff. Incorporating genetic insight also utilize of genomic data to tailor treatments, identification of genetic markers for disease susceptibilities, personalized drug therapy based on genetic profile, genetic counseling as part of treatment plan, are part of incorporating genetic insight when we are planning to develop treatment plan for patients. Physician and staff training is very important. Personally, that's what I believe. The fact that it gives a clear understanding of how we use, how we handle, and how we proceed with the new technologies that are overtaking the healthcare system. So understanding new protocol is a comprehensive need a comprehensive training session on new clinical protocol step by step guides and guidance and flow charts for quick reference, hands-on workshop on practice protocols implementations, using AI tools, training on AI software and tools integrated to EHR system, simulate scenarios to practice using AI in a patient scale, and also continuous supports and troubleshooting assistance. So basically, AI is a recent, though it's not a recent, but still growing and still changing. So updating our individual, I mean, our staff would be a key to success and a key to a best healthcare services to our patients because everything change every day and anytime. So having staff training would be beneficial for the company and also the staff and mainly for the patients so they know what to do when the crisis arises. The other one is emphasizing precision education, which is seminar on principle and benefit of precision medicine, regular updates on latest advancement in AI and genomic, and case studies and real world examples to illustrate the impact. That is a way of how we educate and how we learn from it to it as well. Patient monitoring, a real-time data collection is, and there are two ways where we can do this. A real-time data collection and adjusting treatment strategies. Excuse me. Implementation of a wearable device for continuous monitoring. It could be watch that we can be put on our wrist or any type of device that can monitor our health every second. Integration of real-time data from EHR and patients apps. Also, that's one way of it. Use telehealth services for regular virtual check-ins. We could nowadays start to be patient doctor start using that way of checkups and drug like prescription and talk to the doctors like appointments stuff like that now. It's becoming like a new thing and which is a good thing at the moment since the COVID hit. Adjusting treatment strategies, AI-driven analysis of real-time data to identify trends and regular interdisciplinary team meetings to review patient progress. Personally, I do think team meeting is very essential when it comes to progress and to identify what is going on and how we can change it if something is not working, or how we make it better if something is wrong, but to make it to advance it. So team meeting is essential. Flexible treatment plan can be adjusted based on data and sites as well. And outcome assessment is comparing patient outcomes, metrics for patients' health improvements, what we done before and what worked, what didn't work, and what should we do in the long run. And that is also one of it. In comparison with historical data, patient satisfaction survey also has a way to go. And treatment efficiency analysis, which is success rate of personalized treatment plans, impact of AI-driven interventions, cost effectiveness of treatment. All this can assess the outcome of patients' satisfaction or patients' health. Everything could be used to gather information or data. Feedback integration, which is important what to understand what went right and what went wrong, and to focus group discussions, patient experience reports. It could be a survey, it could be anything, satisfaction survey, and staff feedback. Having that meeting would have would give us like a good understanding of what need to be done at that time and at that moment. Regular meeting is essential, like I said earlier. Training, implementation, reviews, anonymous feedback forms are a key to change the current healthcare problem to a better way of addressing patients' need and patient satisfaction. And all the thing that we need, AI is overtaking it and playing it a significant role in a better way. So the AI being at the backbone of the healthcare system, everything is becoming very accessible and very efficient when we have to when we want to work with the data or when we work to advance the healthcare system, AI will play a significant role. And public awareness and education is teaching community health seminars, workshops, medicine, and AI, public talks and outreach, informative public talk, outreach program in local communities to educate people, and educational like materials distribution. It could be anything that would help the community or in anything with how we reach publics. So this is the information that the references that I use. And it's all my presentation. I'm so sorry for my voice. This is the clearest gonna get. It's been bad for the past 4 3 days. And thank you for listening. Thank you so much.